All right, so please state your name, your first and last name, spell your last name, and then tell us what you do.
Chad Geisinger, Geisinger, and I'm a nurse in the ICU.
Okay. All right, so I'm just going to ask these, and again, we'll just go through them, and if they don't apply to you, just say it doesn't really apply.
Sure.
And then if they're at the end, if there's other things you want to add, by all means, we're open, right?
Okay.
If you could tell the world something about COVID, what would you want them to know?
That it's very unpredictable. Sorry, I just drew a blank.
No, that's no problem. You take your time.
That it's unpredictable. That oh my goodness, sorry.
That's okay.
Yeah.
Get back to it?
Yeah.
Okay, we can. That's fine. No worries. Okay, so what do you advise patients or family or friends about the vaccine?
That you need to educate yourself on if it's the best option for you. Just because you have the vaccine doesn't necessarily mean you're going to not get the virus itself. What it's utilized for, what it's designed for, is to help minimize the seriousness of the illness and to prevent hospitalization.
Do you see that in the ICU with respect
for
to
sure.
vaccinated versus the unvaccinated?
For sure. So I think when a lot of the times when patients come to the ICU, they're on the verge of being put on a ventilator. The ones, and I can think of only a few that I've seen that were unvaccinated and being placed in the ICU. I think the vaccine, when somebody has the vaccine, I believe they don't necessarily make it to the ICU. They may be hospitalized, but it's not to the severity as what it would be if you weren't.
Mm-hmm.
So.
All right.
We may have to do that one again.
Yeah, no, that's fine.
Oh, damn it! I'm so sorry. Okay.
Sorry.
So let me ask that question again. So working in the ICU, when what do you see? What's the difference between that you see between, say, those who are vaccinated and those who aren't vaccinated?
The difference between the people or the patients that come to ICU that are vaccinated versus unvaccinated, the ones that come to the ICU, majority of them are unvaccinated. And I think the reason for that is that they don't necessarily, the severity of their illness isn't bad enough to land them in the ICU if they're vaccinated, where, like I said, vast majority are unvaccinated and they're needing to be placed on BiPAP machines or being placed on ventilators. And a lot of the times after they're being placed on ventilators, we're having to what we call prone and put them on their belly in order to help them oxygenate better. So I contribute a lot of that to being unvaccinated versus vaccinated.
Okay. So what do you tell, again, friends or family or colleagues, probably not colleagues, but I mean, what do you tell people who are reluctant? What would you tell people who are reluctant to get the vaccine?
That, I mean, just kind of take a look around. You see it all the time. You hear stories. You probably know family members. Basically, I just kind of share my personal experience that I've, not just me, but everybody in healthcare nationwide has had to deal with seeing this for the last year or so, or year or two. Just family not being able to be present, having to make those difficult phone calls to families when their family member's not doing well, having to FaceTime with them while they're basically saying goodbye to their family member. I think that's the best way I can put it.
It's got to be heartbreaking.
Yeah. Especially when they allowed absolutely no visitors at that time. And, I mean, the doctor may not be around, but you're having to make the phone call and tell them, and bringing iPads in the room so they can basically say their final goodbye. So it's like, I mean, for the first year or so, I mean, I can't count how many patients had to die alone. I mean, other than us being there with them, and
Right.
that's it.
So, how did you go home after a shift like that? I mean, how do you personally just like recharge, refresh, defrag?
I think a lot of times after a difficult shift, I'll go for a drive and just zone out. And then, I mean, obviously you go home and you appreciate what you have. And, I mean, obviously anybody can get this virus, young or old. And you just don't, I guess, take for granted what you have.
Right. Wow. Wow. Okay. That's really, okay, it's very impactful. That whole last thing we just said, very impactful. We know, and this kind of speaks to what you said earlier, but we'll ask it. We know vaccinated individuals can still contract COVID. What difference are you seeing in how vaccinated patients present versus unvaccinated?
Sure. So vaccinated, when you're vaccinated, obviously the goal is to minimize severe illness or death. Like I said, in the ICU, we see majority unvaccinated. And like I said, I believe that has a lot to do with their vaccination status. I think that if you are vaccinated and you do contract the virus, your chances of ending up in the ICU are a lot less than what they would be. So you might end up on maybe a medical floor and just some minimal oxygen requirements, stuff like that. But when you're unvaccinated, a lot of the times you're coming to the ICU to be placed on a high-flow oxygen machine, BiPAP, or even placed on a ventilator.
So speak to me tell me about the symptomology. So let's say, for example, I have COVID, I'm not vaccinated, and I end up in ICU. How do I present as a patient?
If you're unvaccinated?
Yeah.
So if you're unvaccinated, generally you're coming in very anxious, fast breathing, heart rate very high, blood pressure very high. And honestly, there actually has been numerous times where we're talking about placing a patient on a ventilator and they're asking for the vaccine.
Interesting. Interesting.
And then you have to tell them at this point it's not going to do anything. Yep, it's too late.
Interesting. Yeah. Okay. So, are they scared?
Oh, they're terrified.
Yeah.
And I mean, rightfully so. I mean, like I said, it's very unpredictable as to how it's going to affect you or anyone else. You may have very minimal symptoms, and I could be hammered with it and be that unfortunate one.
Who knows? Yeah. Okay. I gotta get my glasses again. So, do you have any real world experiences that you'd like to share?
Yeah, I mean, there's obviously quite a few, but just that it doesn't discriminate. I've seen elderly, I've seen young. The young patients may not even have any medical conditions, or they might have had just a recent procedure done that's not even related to a respiratory condition, and they're the ones that particular case, I mean, we were placing her on her belly to increase oxygenation. We were having to flip her back onto her back, but then her vital signs were unstable, and I mean, ultimately she did pass.
How old?
31.
31 years old. Okay, so tell me the story again, and this time I want you to present the patient to me. I want
Sure.
you to walk
I didn't know how much detail you wanted me to get into, so.
No, that's fine.
Okay.
But I mean, so we're not going to say her name.
Yeah.
But you could say, we had a female in her 30s.
Mhm.
She came to the ICU. These were the symptoms. This is what we tried to do. She was not, she was not vaccinated, and ultimately, we did this, and she passed.
Mhm.
That to me is like, ooh, ouch. Okay,
Sure.
so start over.
Okay. So we had a female in her 30s who came to the ICU. Very minimal medical history. Ultimately was placed on a ventilator. Got to the point where we were having to place her over onto her belly while she was on the ventilator to improve her oxygenation. As we were doing that, we had issues with her vital signs. We had numerous medications running. And so ultimately we had to place her back onto her back. Luckily, in this case, family did get to see what we were doing. Ultimately, she did pass just due to her being unstable and family not wanting her to continue on with the suffering. Yeah,
All because of COVID.
yeah.
Interesting. Okay, great. Can you think of another patient?
Yeah, currently we have a male in his early 30s, also unvaccinated. Initially started out on the medical floor, but illness progressed, came down to ICU, was placed on a BiPAP machine, which he was maxed out on all the requirements on that. Seemed to be doing fine for a day or so, but his work of breathing increased. The number of breaths he was taking per minute also increased. And then over the last weekend, he did end up getting placed on a ventilator and emergently being placed on his stomach after that. So he'll be on his belly for 18 hours, on his back for 6. And we just have to keep doing that vicious cycle. And yeah, and then when you're placing people on their stomach and the face, they end up developing skin issues, sores in their face. As much as we try preventing it with turning and special pillows and pads, it still happens, unfortunately.
Sure. Anything else that you can think of?
Yeah, how long have you been in the ICU?
A little over 3 years.
Okay. What's it like compared to pre-COVID to COVID? What's it like? How are you guys doing?
Very frustrated, emotionally, physically drained. Turnover, not necessarily in our unit, just nationwide in healthcare, has been crazy. We have a lot of our senior nurses that were there when I started 3 years ago are no longer here or in the medical field at all. We have new grads coming in all the time. So I think I feel awful. I really felt for them because coming in at the start of this pandemic 2 years ago, none of us signed up for this. And so them coming into this, yeah, they were nursing students, they got to see bits and pieces of it, but until you're essentially thrown into this madness, they had no idea, and they seemed to, overall, they seemed to do well overall, but you can just tell that they weren't doing well, inside. I think mental health has been a huge issue, whether anybody wants to admit it or not. But I think since COVID has hit, everybody's attitudes have changed. Obviously, morale it is what it is. You go there, you do a job, and it's great when you see a positive outcome when somebody gets off a ventilator, something like that, or even discharged from the hospital. But 9 times out of 10, you don't get those good outcomes, even despite everything you do. And so that answer.
Yeah.
Okay.
That's great. Yeah. That's got to be so defeating.
It is. It's like you spend all of this time and just mental energy trying to do all this stuff and prepare for what might happen next, or and to have it not go the way you expect it or want it to go. And like I said, majority of the time but I will say one thing: the first wave that came through, it seemed like it affected more older. It seemed like we had worse outcomes with that. It seems like we were not getting people off ventilators, or we were having to have tracheostomies placed due to being on the ventilator for a prolonged period of time. It seems like this time around, it's older and younger, but it seems like I've seen more younger people in the ICU on ventilators. It seems like at this point, though, that we are able to actually they might get a tracheostomy placed, but they will go to a long-term care facility and start the rehabilitation process, or they will actually get off the ventilator altogether. So that seems like it's it feels a little bit better, but it's still, I mean, we've had obviously 2 years to manage this, so it's obviously kind of our new norm, sadly.
It's heartbreaking. So, I guess I didn't ask the last question on here. If you could, wait. My question. We've been dealing with COVID for almost 2 years now. In your opinion, what will it take to end it?
To end COVID, I honestly think it'll always be here, no matter what we do. I think what we're trying to accomplish with the social distancing, the masking, the vaccine, is that getting the vaccine, obviously we want to provide some immunity. I think over time, it's going to be almost like a common cold, just because there's numerous coronaviruses out there. And I think with either natural immunity or being vaccinated and also having COVID at one point, I think that eventually it will turn into a common cold. We're not even close to that point, but I think that's what our ultimate goal is, where it might just be a sniffle, cough here and there, and it'll be no big deal. But I think we're pretty far away from that yet, so looking at vaccination numbers and everything else, so.
Okay.
I don't know if this would apply, but do you think describing what it is to get a ventilator, to be put on a ventilator?
Sorry, what was?
To be put on a ventilator?
Yeah.
You want to describe that once?
Like just the process?
Yeah.
Or,
Okay. So So what if I'm laying there in the ICU? Again, how do I present, and so that somebody comes to that decision?
Sure.
And then what does that look like?
So generally when somebody comes to the ICU and needs to be placed on a ventilator, they are very anxious, heart rate is very high, blood pressure is high, oxygen saturations typically are very low. They might do what they call an arterial blood gas to get your oxygenation numbers through that reading or the measurement. Depending on how that looks, they will make the decision whether you need to be placed on a ventilator. If the patient is coherent enough, they will obviously get consent from them. If not, then obviously we got to talk to the next of kin or whoever's the power of attorney or family member. Obviously that conversation is not the easiest either, because the likelihood of when you get placed on a ventilator, the likelihood of coming off is very slim. So they will receive medications in order to relax them, put them to sleep, paralyze them. They will have the breathing tube placed. They will have other lines placed, central lines, arterial lines to monitor blood pressure. Then they'll be placed on certain medications in order to provide sedation for them. A lot of the times what we're seeing with COVID patients are that they have to be on large doses of sedation. For some reason, they just seem to break through it. And obviously, for them, it's probably like waking up from a sleep with a tube in your throat and probably not knowing where you are at that point. And all of our patients that are on a ventilator that are sedated are restrained. That way, if they do come around, they can't rip stuff out. So you're basically restrained. You wake up and you're in this unknown area with all these machines and stuff going. You might see people, you might hear people, but you don't know who they are at that time. So I can't imagine waking up to that. And I think it's like, for me, it would probably be you be in a deep sleep and somebody scares you and you kind of just abruptly wake up. And I mean, yeah, that's how I would describe it. And then some patients, when we're having to place them on their stomach or prone them, we're having to give them additional paralytics and other sedation in order to do that. Basically, that's for our safety in a roundabout way. For some reason, if the tube were to become unhooked from the ventilator, we don't want them obviously coughing and putting aerosolizing particles into the room. But also when you're taking a 300, 400-pound person and you're flipping them, and if you're not completely out, obviously I would try fighting that too. But yeah, so.
I
But
never thought about that.
what's that?
I never thought about that.
And I mean, when we have to prone somebody, it's usually a 5-6 person job. So you basically take out at least half of your nursing staff in order to prone one person. And there might be 4, 5, 6 of them that you're doing. So you just go down the line, and the process that it takes to do all that, I mean, probably takes a good 20 minutes just to get everything ready, not including flipping them. You got to have respiratory therapy in there to manage the ventilator, and so it's definitely a lot of work. I mean, it doesn't seem like much, but and I think a lot of hospitals have actually implemented like turning teams or proning teams, where they'll basically go from room to room and
Sure,
do that stuff.
sure. All right. I think that's all I have.
Okay.
We got it?
Thanks, Chad.
I hope it wasn't too bad.